At this stage, we really have very strong preclinical data, and that data really supports that this technology can work. These constructs get into cancer cells and uniquely express downstream transcripts that activate the immune system within the tumor environment. This has been a big problem within oncology. How do we turn cold tumors hot? And I think this is a really unique approach that really has potential.
The ability to really start seeing consistent demonstration that the platform is working in animal models is, for me, a validation that there will be a high likelihood of seeing the same similar effects with respect to the tumor uptake of the LNP and the specific production of the desired construct in the tumor model.
The preclinical data from early looks exceptionally strong in proving the thesis that delivering the drug locally can have a much more efficacious effect to having the drug made by the tumor than delivering it systemically.
This, to me, is sort of the likely translation of all the preclinical data that's been generated to date. That provides a much higher level of evidence going into the clinic.
The most important thing for a pharmaceutical company is to capture innovation. I see what Early is doing having the potential to be truly transformational. I like to say that when something that I've reviewed works, not if it worked, but when it works, will it really be a game changer? And what I've seen so far, I've been very impressed that the Early approach could be a true game changer.
When pharma companies are looking for other assets that are, going to be potentially effective, they're always looking to see how it could help them build not just one drug, but build a franchise. And for those pharmas that are already involved in the disease areas where this platform can be very effective.
Unless you have something that is truly differentiated, like the Early approach, you won't be able to get to have value. So I think that pharma will have great interest based on the innovation that really is the hallmark of what Early has done.
This provides a nice complementary mechanism where you could actually build not just a one drug commercial opportunity, but a complete franchise around the platform to enhance the anti-tumor efficacy of checkpoint inhibitors, for example, in disease areas like non-small cell lung cancer.
So when something is unique and it stands out as highly innovative, and this is what great pharmaceutical companies need if they're going to stay ahead of the pack.
So cytokines like IL-12 have tremendous potential in treating cancer, but they've always been limited by systemic toxicity.
IL-12 is a potent immune activator, and of course there's been a lot of history trying to get IL-12 activation as an immunostimulant for cancer therapy.
So having the IL-12 made by the tumor, as in Early's approach, could be the way in which to harness the potency without getting the profound side effects you get by delivering it everywhere.
The strategy here, I think, is really unique in that it's the cancer cells that will be producing the IL-12, so there will be a local inflammation specifically where the tumor is, limiting systemic exposure and focusing that activity where we want it, which is in the tumor microenvironment.
So I think, the way I look at the platform is it has solved the major obstacle in delivering something that we still believe is extremely important in achieving an optimal IO therapeutic benefit.
One of the key things when you look at a company from the viewpoint of an investor, is there an obvious killer or de-risking experiment? And Early has done a lot of them in the preclinical work, including in non-human primates.
I think the early platform is really entirely unique, in my view, within the oncology landscape.
Early's technology is one of the most promising new technologies I've seen.
And I think the innovation here is really unique and potent and complementary to the other things that are going on in the field.